I live in Southern California, sunny Southern California. I've been here about 8.5 years, and this is the land of breast augmentation. So I bet you know where I'm going with this. I've been asked the question by multiple patients, can these wonderful breast implants that I have, Dr. Harness, increase my risk for breast cancer? The answer, simply stated, is no. Now, could it make it a little more difficult to make a diagnosis of breast cancer? And when mammograms are done with women with breast implants, we have two main views that are done: cranial caudal, squishing the breast up and down, and medial lateral Blike, squishing from the side. Where I work, in most breast centers that I'm aware of, do two different sets of mammograms on the side where you have, well, each side obviously, where you have the implants. First is with the implants in place, and then second is called the extraction views, where the implant, believe it or not, is pulled out of the way. The breast tissue is put back in compression, so the implant, if you will, is out of the picture. Is this, how do I put this? Is this a little less optimal? In other words, are there certain areas of the breast, because the breast is being pushed forward by the implant, or because of the technique of the extraction views, where you may not get sort of perfect imaging? And the answer is yeah, there are some, if you will, sort of blind spots or areas that are a little more difficult to image with the implants in place. So what do we do about that? Well, we're not going to get rid of the breast implants. So what we want to do is to make sure that my patients and you are doing very careful breast self-examinations each month. If you're still having your periods, doing it after your period is a good time to do breast self-examination. One of the advantages, the breast implant underneath the breast tissue is compressing things upward, so the breast tissue is sort of thinned out. So when you're feeling with your hands, it's actually a little bit easier to feel distinct lumps in the breast. So the take-home message is no, breast implants do not cause breast cancer. But what's important, obviously, is getting your mammograms done regularly, get it done in a center that knows how to do extraction views, and really importantly, continue doing breast self-examination. And if any findings come up, see a competent provider right away. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.